Hey guys, ever wondered the similarities between a baby growing up and achieving their milestones, as well as a stroke survivor recovering and rehabilitating? Well, consider this, that both these groups of individuals actually grow from a lying flat position in the bed, and then they get into sitting, standing, and eventually walking. And this is just one similarity, and in this video we're going to explore two more lessons that we can learn from babies as they are growing up and apply it to a stroke survivor's recovery journey. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. So the first point, as I mentioned earlier, is the initial milestones and basic movements. I did a video about this for stroke survivors 2 weeks ago, and I'll actually link it in this video and in the description as well, so you can take a look. Basically, it's about planning your stroke recovery journey, and this point is similar in the sense that both the babies and the stroke survivors actually start off from a very low level, whereby they're just lifting up their heads, sitting up, standing up, and then walking. And this is very similar to a stroke survivor as well. So the similarities between these two is that the importance of the building foundational blocks, and you should not try to skip any of these foundational blocks, meaning if you're not able to sit properly, then you shouldn't think of standing for too long or even walking, because it is going to make you very unstable and unsafe for you to walk. So try to master the basic blocks first before moving into the next level. So the second point that I want to bring up is repetition and practice. If you look at a baby, they actually go through a lot of repetition and practice in a day itself. The moment they get up, they're off to playing, experimenting and exploring the world, their toys, their hands, their legs. And this is the attitude that we need for stroke survivors. Because in a stroke recovery journey, you actually need to just have that repetition in the early stages. Yes, rest is important, but repetition is actually even more important, because most of the time in multiple studies, it has been reported that it's not enough for the majority of the stroke survivors. So always look back at a baby, how they're just going at it again and again and again, and this is the attitude that is required. Keep on practicing and keep on thinking that you are going to end up using your hand or your leg. So the last point I have is actually the attitude of not giving up. If you were to look at a baby in a day, you realize that they have multiple sets of failures within a day itself, but they don't give up and they just keep going at it again and again. Yes, they just sit down and cry for a brief moment, and the moment you comfort them, they're back at it again. So this is the attitude that actually we need for stroke survivors, of not giving up and just trying again and again. If let's say you have a down day, sit down, reflect. If you want to cry, cry a little, then get back at it again. And use your caregiver, use your therapist, ask them for motivation, ask them for inspiration stories, and use them as a stepping stone for yourself to actually get better at recovery. I've done a few videos on having a better mindset for stroke survivors and recovery journey itself. I'll link it up in this video. And that is my 3 points for today, and I thank you if you have watched all the way till the end, and I'll see you in the next one.